Hi everyone. So the guy that I picked for the discussion post this week in the video to talk about prolonged trauma was sort of manifesting. He described some interpersonal difficulties, which I thought was really interesting. So he had some insight into when people begin to get too close and he begins to feel too vulnerable, that he has noticed sort of beginning some interpersonal conflict and starting arguments or making situations really dramatic or blowing things up to sort of as a defense mechanism to sort of stifle any sort of vulnerability that he was beginning to experience and kind of cut that off. And so I imagine that that is creating a lot of interpersonal turmoil and instability. And I think that a lot of times people conceptualize, people with severe trauma backgrounds and these defense mechanisms that they either cognizantly participate in or subconsciously participate in as being, borderline personality disorder, mood instability, various things. And so then really the way that those issues end up being treated and talked about and the stigma that's attached to them and the types of care that they get really changes. And I think that's really, really interesting, and that's a good thing just to keep, especially for me, to just keep in my mind, really listening to people and listening to their story and trying to get at that root cause and not just my interpretation of their experience or their behaviors. So really coming alongside people rather than sort of projecting my own interpretation onto them. And I thought it was really interesting as well. He goes on to describe sort of the physiological effects of trauma that he still experiences and how he'll blow up on people or when he's in a grocery store or in a bus terminal, people brushing against him is very triggering for him. And he can describe really clear physiological responses that he's having. And that is very insightful and kind of impressive to me. I try to think back, like, in my day-to-day functioning, and I'm so unaware of my physiology and how my body is responding to my environments most of the time. And so the amount of energy and skill that it takes to really assess sort of what those experiences feel like is pretty amazing. But in the book we're reading, The Body Keeps the Score, they talk about sort of describing that as a physioneurosis, and I found that really interesting, and I feel like that's a really good way to describe trauma and PTSD symptoms, because there are so many full body responses that people have, and it's not just the whole, like, they're suffering from memories. They talk about that in the book too, the Sigmund Freud side of things, but like, the cold sweats and the fast heart rate and sweaty palms and shaky voice and shallow breathing, and there's like all of these things, upset stomach, all of these symptoms that people experience that, like, it really begins to take over your whole body. And so it's not always just a mind over matter thing. I mean, you really have to treat these things holistically, and I think that this particular individual sort of covered that a lot. And he talks a lot about sort of like the vulnerability and how impactful that's been, and how people misunderstand him, and he feels like people are judging him, and they don't understand how just brushing up against him is actually interpreted in his mind because of his severe trauma history. And I think about all the ways that we interact with each other, and there's the service industry, and there's all of these things, like he brings up the bus system and the grocery store, and it's really hard to have expectations that those people will be trauma informed, and so kind of how do we empower those people that really come into contact with so many types of people, but then also empowering individuals to really to voice their needs and to allow themselves to be vulnerable. That's a challenge that I look forward to learning more about, but I think non-trauma informed organizations would probably find a person like this dangerous, especially depending on their size. But like, this guy's a really big guy, and if he's just explosively blowing up, and internally he's feeling very scared and very vulnerable, but it's coming off as very aggressive, and he seems dangerous to people that don't know him or know his background or know what that experience is like. And if he doesn't feel empowered to articulate those things or comfortable enough to do that, that's a really tricky spot to navigate, for sure. And what will be important when engaging this person? I think it's just really important in learning through this course to really, really listen to what people are saying, and to really ask for clarification, and to validate their experience, but also really clarify your understanding, because there's such a power dynamic in how we represent people in our documentation and in our conversation with colleagues, and there's a lot of stigma that goes with that, even within the profession, and with those labels that we give people and how they're treated in the future. And so I think just honoring those things and making sure that that you're really doing the best to be an ally and an advocate with that person, and trying to understand their experience from their position in society, rather than your position understanding it, which can be very challenging as well. But anyway, I hope everyone's doing well, and I'm really enjoying this class so far, and I'll talk to you guys soon.